You're in a particularly good position to comment on what's going on with healthcare in this country and the fight against coronavirus, having served not only as a congresswoman from Florida, but also, of course, as Secretary of HHS. So what do we need to do in this country on healthcare, particularly when it comes to the coronavirus?
Well, when it comes to the coronavirus, obviously what we need is national leadership, national standards, and national purchasing. The execution can clearly be done by the states, but under national standards. And by that, I mean paying attention to the science, letting the public health people decide what that standard is, and making sure every state executes accordingly. That means more than masks. It actually means that in some places we may have to close down for periods of time, but we have to have testing as a strategy. Right now, it's a mess. And there isn't testing available in some areas. We're short of PPE, and that's because the national government hasn't done its role. It could have purchased all the supplies. It could have distributed them fairly, but more than anything else, it could have set a national standard for what the expectations were. So, Jamie Raskin, the congresswoman from Maryland, and I introduced a bill that really described federalism at its best. The national government would do the purchasing, it would set the standards, the states would come in with their strategies to meet those standards, the national government would fund all of it. That simply wasn't done, and that's to our tragic results. Millions of people all over the world have gotten infected, and in our country, thousands have died, over 170,000, many of them unnecessarily, if we had had a national strategy.
So, Congresswoman, some breaking news. Even has been talking that Oracle now has entered the race to buy TikTok's U.S. operations, taking us back toward China and reminding us of the conflict between the United States and China over technology. And it actually does bring us back to coronavirus itself, because as we've heard, President Trump really blames China for not jumping on this earlier, not being fully disclosing about what happened with the coronavirus. And then there have been reports that China may actually be trying to steal some intellectual property having to do with the vaccine. Is part of the problem here China?
Well, initially part of the problem was China, there's no question, but we didn't start early enough. We knew about the breakout of coronavirus in China, and we did not act immediately. We had that information. The CDC had the information. It was reported to the White House, to the Secretary of HHS, and we did not put that strategy in place immediately. We fooled around because the president didn't take it seriously. We can blame China at the beginning, and China stealing intellectual property, so what's new there? They've been doing that for years. And frankly, the idea that a vaccine and the information about a vaccine would be stolen, would be taken by another country. Listen, the scientists are going to make this all public. We'll all know what the scientific basis is, the underlying information, the studies on a vaccine. It will be shared with the world. And right now, the CDC and the NIH have commissioned a study from the National Academy of Medicine to give them strong recommendations on how the vaccine ought to be distributed. So I don't think it's anything new with China stealing intellectual property, trying to steal a vaccine from us. There's no way to steal it from us because the information is going to be available to everyone. It will not be proprietary. Science is not proprietary. It's involved in saving lives.
Congresswoman, it's Jeannie Zaino, and I wanted to ask you, you just referenced the development of a vaccine and the issue of distribution, and previously you mentioned the problems with distribution of the tests. Do you have any concerns that under a Trump administration, if and when a vaccine is developed, we would experience similar challenges with distribution of a vaccine? Because that's something we are hearing an awful lot about from people in that space.
Well, that's why I referenced the National Academy of Medicine and their recommendations. And let me be clear about this. I expect the vaccine not to be ready until the Biden administration, and they'll have a clear plan for the fair distribution. But the run through, the first days out is going to be on the flu vaccine. In September and October, we're going to build out our infrastructure to make sure that as many people as possible get the flu vaccine. Right now, about 45% get it. We need to get up to 70 or 80%. That will give us the infrastructure for the distribution of the vaccine for coronavirus.